we takes while in the exam. So I know many candidates have already appeared in the exam, and few of the candidates are just remain in the last diet. And tomorrow, I think, is the exam of India Center, and in the coming week, there's the exam of UK Center. So I wish you all the best of luck for the exam going candidates. And Dr. Shruti just, text that she wants to volunteer for today's mock. So, Dr. Shruti, you want to volunteer for the history or the communication?
Can I please go ahead with communication first, ma'am? Haven't practiced that yet.
Okay, perfect. And tomorrow is your exam, right?
Yes, ma'am. Yes, ma'am.
Yes. So be, calm, be confident, believe on yourself. You have been practice a lot, and hopefully, inshallah, you know,
Yes,
besides, the practice, always control your nerves. So let me. The thing is that I have. So if you want to go for the communication, just a reminder for all, the communication station, we have two communication stations in the circuit. The all station that, comes in the exam, we call it circuit. There are two communication stations, and each communication station comprise of 8 marks, right? Total 9-minute station, and 4 minutes station. 4 minutes you will get once you will outside the station for the preparatory. You just sit outside the station. The scenario will be hand over to you by the invigilator or the moderator. You just have to read carefully. Please do read carefully. Note down the name. Note down the child's name, the parent's name, and just highlight in the mind what exactly this communication is. Is it breaking bad news? Is it a consent? Is it an information giving? In that, 4 minutes, just focus on exactly what this communication is all about. And just frame your communication that how I will start. Look at the setting. What is the setting? Is the ward setting? Is the ER setting? So these are the all, tips that will guide you that how I will introduce myself, how I will start my station. Okay. So Dr. Shruti, if you are ready, let me set the timer. And
Yes, ma'am.
okay, just wait a minute. Let me set the timer. And so you have in the exam you will have 4 minutes. Here I'm giving you the 3 minutes for the preparation. So your time
Sure,
starts now, Dr. Shruti, and this is your scenario, right?
Oh.
The time starts. You have 3 minutes to prepare the scenario.
Okay.
मम्मी आज छोटी वाली है
Your time starts now, Doctor.
Hello, good morning. I'm Dr. Srishti, one of the child doctors here at this center. I believe I'm speaking to Mr. Scott, Sam's father,
That,
Samuel's father.
that's correct, Doctor. Thank you for seeing us.
Thank you for seeing me, Samuel's father. I would like to discuss something about Samuel at the moment. Do you want anyone to join our discussion?
Doctor, that's fine. It's only me, and I was waiting for you as well. Yes, Doctor,
Right,
please go ahead.
right. So before we begin, could you tell me what you know about Sam's condition?
So, Doctor, my son is, was running a fever and suddenly he developed some unusual movement. So scary for us that we rushed to the ER. And, the good thing is that he recovered, and one of the staff said that he's out of
Right.
danger. But I have few concerns, Doctor. But before that, would you please tell me what exactly happened to the Samuel?
Right. I'm so glad that you are so aware of Sam's current condition and you're willing to know more. I'm right here to discuss the same with you, Mr. Scott. So, what Samuel went through, we call in medical language as a febrile seizure or a fit that is caused because of fever. Do you understand?
Okay, doctor. So, is it something serious, doctor?
Um,
The terminology seems fancy, seizures.
right, right.
How serious it is?
So, seizures. Right. So, Mr. Scott, in Samuel's case, it is because it was caused, the fits were caused by fever. And upon our investigation, we noted that the primary reason for these fits were the fever itself because of the throat infection he's had. We don't categorize it as a very dangerous condition. Do you get me?
Yes, doctor, I get this, but isn't it that, in the future he might develop it again and again?
Right, right. So that's a very good question, Mr. Scott. So the one that you're talking about is called epilepsy. Have you heard the term before?
Yes, doctor, I Google it about it, and, I was
Right,
just waiting and I was, scrolling my phone and I just Googled this term, and it's
right,
a
right.
very scary, doctor, and I'm very afraid that is what if my son developed that?
Right, I can understand. Of course, the internet is a vast ocean and it can really make anyone scared based on all the conditions given there. But in Samuel's case, if you see, epilepsy is usually not caused by fever. There could be various causes to cause it, but not fever. But in Samuel's condition, he falls in a bracket of the age group where children, because of infections, when they develop fever, the fever is the reason to trigger fits, and these kind of fits are not very long term, though it can happen again whenever he gets fever. But we know this is a very brief condition and it doesn't last long, and it will not go on to happen like epilepsy, which happens multiple times without any fever condition.
So,
Do
doctor,
I make
just yes, doctor, I understand that. But I have one question. One of my friend's son, he developed the
right?
fever, and after that, he developed this, the fits. And the
Mhm.
CT scan, after that, when they investigate, it showed the CT scan that he has a brain
Yeah,
tumor. So, doctor,
right.
would you be proceed with the CT scan in him?
Okay. So in this condition, probably I'm not. Probably we need to get to know more details about what happened with your friend's child. But usually, when we plan to do a CT scan, we need to find symptoms or physical signs that make us want to do that. But with all
Okay.
our investigations that we have done, it is a very typical fever related seizures that's happened. And best part is Samuel has recovered very well. So that all the more reassures us that at the moment this is not required. But what we can
So,
do, Mr. Scott, is
mhm,
yeah, please go
mhm.
ahead.
No, no, doctor, just go ahead. I'm listening.
Yeah. So what we can do is we can when we be calling you back for a follow up, and we'll give you some reading materials about this condition as well. We let you know about the danger signs that are associated when there is a fever and a fit involved. And if you notice any of those things, then when you come back to us, we will decide accordingly. But at the moment, right now, do we need a CT scan? Fortunately, no, Mr. Scott.
And doctor, one more thing. How many, is there any chances that he might progress toward that epilepsy that I've been reading about?
I cannot say it at this moment, because if you see, epilepsy can happen because of so many reasons. But we
Yeah.
cannot predict when we cannot predict accidents in future. So what we can do now is just to make sure that he is developmentally well. You come back for regular vaccinations, come back for the
Doctor, can
checkups
you
that
please
we
give
are.
me any rough idea that is there any rough idea? Nowadays the research has been going and there's been
Yeah.
studies. So does any study show that this percentage has a chances of getting the child
Um,
epilepsy? Is anything
okay.
like that?
I currently I'm not aware about it, but I will go and read on it, and probably we can
Okay.
schedule another meeting, and I'll discuss with you on this, Mr. Scott, so we can have another meeting about
That,
this. How does
that,
that sound?
that's absolutely fine. That's
Oh,
absolutely perfect, doctor.
that's a very
That's
nice
quite
question you
reassuring.
posed, yeah, Mr. Scott. Why don't I give you some reading materials? And because I've spoken so much at this meeting, is it okay if I summarize for you?
Yeah, that's perfect. 7 minutes past. That's
Right.
perfect. That would be
Right,
great.
thank you, Mr. Scott. So what we discussed was that Sam yesterday he had come for the fever and fits, and now he's doing very well. And on our examination, we noted that he has a throat infection which caused fever, because of which he got fits. Right, but these fits are called fever-related fits, called febrile convulsions. So they are not dangerous at the moment, and Scott does not need
Yeah.
to have any further tests. I'll give you some reading material about febrile convulsions. You can read on it, and we'll schedule another meeting to know.
Sorry, doctor. One more question I
Yes,
have.
please go
Sorry,
ahead.
doctor, I just interrupt you. One more question come in my mind.
Yes, yes.
Till which age I need to observe this that I'll be relaxed that this is a febrile convulsion. Is there any age bracket
That is a,
to
of course, that's a beautiful question. These kids, right from the month 6 months old to 5 years of age, anytime if the child has fever, there are chances that he might get this convulsion. Especially the kids who have a family history, also they tend to have these kind of convulsions because of fever. So that till that age you have to monitor. After that, if the child is getting, that's where we come into the picture, and then we'll investigate. Am I
that's
audible?
absolutely, doctor, understandable.
Yeah.
And thank you very much for giving.
ന്യൂസിൽ ഓൺലൈൻ ക്ലാസ്
So much
நிறைய பேரோட IoT NMS
for your and being
IoT
patient with me, understanding. And I shall see you again then. Hello?
Yeah,
Hello?
that's perfect, doctor. That's can you
Yeah,
please? Yes, hello.
yeah. Okay.
Yes,
Thank you,
doctor.
Mr. Scott,
That's perfectly fine.
I wish you and Samuel all the best. Thank you.
Thank you. Thank you so much, doctor. Your time's also up, doctor. Okay, Dr.
Ma'am, someone's
Shruti.
mic is on.
So that was, yes, let me see whose mic is on. Actually, here I can see no one's. Whose iPhone? Can you please mute your mic? Okay, so Dr. Shweta, so tell me, how do you feel?
Ma'am, after so many self-practice sessions, I feel I did okay. Uh, but please, I would need
You
your
did
expert
very well,
advice.
actually. You did actually very well, mashallah. Right? So if I say, I usually, I try to be elicit more, highlight the errors which candidates usually do. But here, your empathy, your emotions, your tone, so everything was spot on, and the flow of your communication, that I would
Thank you, ma'am.
say. And please be like that in the exam, please. Right?
I
Any
just
of the
pray.
candidate so I wish you all the best of luck. The way you did, perform today, the acknowledgement, the short sentences, and keep acknowledging. So this is exactly examiner wants to know and wants to, so actually you did well. So I
Thank you,
will,
ma'am. Thank you.
give you, you know, uh, expect that this is the same way you will perform tomorrow. And inshallah, if you perform
Thank
like
you, ma'am.
this, you will definitely get a full score in the communication. So any inputs from the audience?
Thank you, ma'am.
And best of luck, Dr. Shruti. And it's with
Thank
this,
you, ma'am.
you know,
Thank
the
you so
same
much.
tone and,
And actually,
continue with the same tone
yes,
in the
ma'am. I've
history,
been
your body language, your repo, this
yes,
all
ma'am.
matters, right? So this is
Okay,
the
ma'am.
first time, Dr.
Noted.
Shruti, you are appearing?
I'm
Yes,
sorry to
ma'am.
interrupt.
Okay.
I'm
So
sorry to
excellent,
interrupt,
Dr.
but
Shruti. You explain it really well. You handled all the question, the
Ma'am.
age, what is the percentage? You know, 1/3 percentage or the 0.3% children have a tendency to develop the epilepsy. Just do confirm that. But
Okay.
usually you can say, keep yourself safe. The 1/3 children have a tendency to develop the epilepsy if
Okay.
there's a family history positive, right?
Okay.
So you can
Right.
say it like that, but you handle it very well. Examiner is happy if you are not well, but you handle it very well that I'm not sure at the moment. I'll look into it and get back to you with the updated information. So this is the best way.
Sure.
If you're not sure, rather than giving the wrong information, you can handle like this exactly the way you did it today. Sure.
Right.
So
Right.
all the best, Dr. Shruti, for the exam.
Thank you. Thank you so
So,
I'm
much.
sorry.
so whose
I'm
exam
sorry to
tomorrow
interrupt.
again?
I'm sorry to
Yes,
interrupt. Can
Dr.
I have?
Rizwan.
Yeah,
No, no,
yeah.
that's
Actually,
sure, doctor.
I think that if I'm not mistaken, that recently this it's a change from 6 months to 6 years, not 5 years. If you can please check it.
Okay.
The right
Dr.
conversion.
Rizwan, there's a multiple books. There's a multiple books. With some books range 5 months to 6 months to 5 years. Some books say 6 months to 6 years, right? But you just need to
Yeah,
recheck in the up-to-date guidelines.
yeah. Because
So the
earlier,
recently,
earlier we used to take it after 5 years on, but recently I think last year they changed from 6 months to 6 years. If I'm not
yes, and
mistaken,
now
you can
there's
double
one,
check it,
yeah,
please.
yes, and now there's one more terminology that's called febrile fits plus, febrile seizure plus, right? If there's a strong family history, there's another scenario for that, but you need to look into it. I think they won't include that in this thing. But Dr. Shruti, 6 months to
Right.
6 years is easy to remember, and just keep that in
Right.
the mind, right? 6 months to
So, ma'am.
6
Thank you
years.
so much, Dr. Rizwan.
Welcome.
I'll keep that in mind. Thank you.
Thank
Thank
you,
you,
Dr.
ma'am.
All the
Rizwan,
best.
for
All the best for the
welcome.
exam.
All the best.
Thank you so much.
All the best, Dr. Shruti.
Thank you.
Okay, so who's the one who's going to volunteer for the history taking? Anyone? The exam going candidate? Dr. Rizwan?
I would love to,
Come
but I'm
on.
on
No?
duty. I would love
Okay,
to do,
okay.
but I'm on duty and I'll
That's
get interrupted.
that's okay. That's okay. Anyone else? Otherwise, we'll give Dr. Shruti to perform again for her, as tomorrow is the exam. So it will be a small mock for her.
Yes, ma'am.
Please, anyone else, please come forward. These mocks are designed for you just to, no matter your exam is far away, but still you have a chance to, this exam is all about talking. So you have to come forward and talk. Without this, if you say that we only talk on that day, that would be too difficult, right? So you have to keep practicing that how I communicate, your body language, your tone, your flow, everything matters. And this only happen with the practice.
Ma'am, for today, can I go ahead, ma'am? Because I've attended very few mocks, if that's okay. And I think my history is, that is one thing I'm trying to, I don't know how it's going to happen
Okay.
tomorrow, but I can do it once with you, ma'am.
Okay, fine. That's if no one
Thank
is,
you, ma'am.
coming, then obviously tomorrow is your exam. This will be, definitely we'll give you a chance. And so for me, this is a mark sheet, Dr. Shruti. You're gonna see the mark sheet of, how they, give you the marks. They'll just tick on meet the standard, borderline, and
Yes, ma'am.
below the standard. But definitely, we hope that everything you will get on meet the standards. Inshallah. Okay, so this is your history. In history, know the breakup, Dr. Shruti. I don't have to. Just a
Yes,
reminder for
ma'am.
all the other candidates. Just for the reminder for all the other candidates that History station is a 22-minute stations, right? And it carries 10 marks. Till the 9 minutes, you have to take the history. And at the 9 minutes, the bell will ring, that they will tell you there are 4 minutes remaining. And at 13 minutes, you will complete your history. And then remaining 9 minutes, you are with the examiner. In that 9 minutes, you have to summarize your history and you have to face the examiner questions accordingly, right? And just a little bit, tip for the history. There are three kinds of history. The acute history, the chronic history, and the acute on chronic history. Acute history in which you have to diagnose regarding the acute complaints. The chronic history in which they are already been diagnosed, but there are some issues that you need to discuss about. And the acute on chronic history, the child has been already diagnosed, like the Down syndrome, and now he's present with some lethargy or that. So we call it acute on chronic history. So this is how we divide the histories. And if you have a clear concept that how we have to approach those history, definitely. So this is your station, doctor, history
Okay, ma'am.
information scenario. Your time starts now, right?
Yeah. Okay, ma'am.
Your time starts now, doctor.
Hello, good morning. I am Dr. Srishti, one of the child doctors here at this center. I believe I'm talking to Mr. and Mrs. Melling, Ashley's mom and dad. Is it?
That's correct, doctor. Thank you for seeing us, doctor.
Thank you for seeing me. How are you both doing?
We doing well, doctor. Actually, we are new in your city, and our
Right.
GP sent a letter to you, and I hope
Right.
that you review the letter.
Yes, yes. I did get a letter from Dr. Smith, and I'm here to talk to you about your concerns. But before I do that, do you want anyone else to join our discussion?
No, no, doctor, we both are here, right?
That's fine. That's
Yeah,
lovely.
yeah.
Yeah. So please tell me what brings you here. What are your concerns, Mr. and Mrs. Melling?
So, doctor, as you know that our son has been already diagnosed with the cerebral palsy, and
Right.
he's been, under the follow-up. And we recently moved to this new city, and we don't know anything about this. Uh, uh, what doctors and where should we go? So our GP said that we should see you, and you will guide us regarding all the concerns. So here we are.
Right. Right, absolutely. You are here at the right place, and I'll do my best to help you in this. So, welcome to our city. By the way, can I
Yeah.
please know what are your recent concerns for Ashley in particular?
Uh, so, doctor, we have been noticing that he has some, in complaining of the pain in his hip joint. Along with that, he was not able, initially was able to move on, with his uh, the walker thing, and we have been seeing
Right.
physiotherapists. But as we have new in this city, we find that he
Mhm.
feels some difficulty in movements, and I've been noticing that his, bending of the, his back is now more obvious, and I don't know what to do for this kind of thing, doctor.
Okay, I see. And could you tell me a brief
Right.
duration? When did it start?
Hello.
When did it start, Mrs. Melling?
Am I
Hello?
audible?
Hello?
Hello.
Yes, you're audible, ma'am. Hello? Hello? Ma'am, I can hear you. Hello?
Yeah, yeah. Yes, yes, yes.
So
Yes, so
please tell me,
doctor,
Mrs. Melling.
yes, so the bending is now more.
Uh, can anyone from the group tell me, is it me or is ma'am gone offline?
She's
She has
gone
gone
offline.
offline.
Oh, thank you so much.
I'm sorry, it's from a connection disconnection from my side, but I hope
Right.
now I'm audible.
Yes, ma'am. Perfectly fine.
Okay. Okay.
So, Mrs.
So
Melling, you were telling me about the pain, the bending.
yes, now the bending is more obvious, doctor, and I can see that he is, complain of more pain. So doctor, we are
Right.
worried that what to do next.
Okay. Okay. And is it increasing? Since how long has it been increasing? Could you give me an estimate?
Doctor, I think we have been here for past 2 months, and we have been noticing he has some difficulty in movements, and
Mhm.
this is very alarming for us, doctor.
Right. Right. I see. I'm so sorry to
And he
know
has,
that you. Yes. Please tell me. Please go ahead.
and beside that, doctor, he has some other issues, as you know that cerebral palsy children say they have multiple issues. So we
Right.
also want to address that he's also on the gas. He has a tube in his stomach.
Mhm.
So we need to sort out that issue as well. The sometimes we feel more, I don't know, he's arching what because of the
Mhm.
inability to digest. We also want to discuss that issue as well.
Okay, I will take care of that. Thank you for informing me, Mrs. Melling. So, could you tell me who all were involved in this team back home?
Yes, doctor. We have been seeing our community pediatrician, and we have been seeing our physiotherapist. He's been connected with the gastroenterologist, and he's been connected with the speech therapist. There's a whole group of team, doctor. Neurologist was the main person that the
I can't hear you, Miss Melling. Um, it's ma'am again, right?
Yep, she's
Thank
gone
you.
offline.
Thank you.
Very sorry, Dr. Shruti. This is from my
No
side.
problem.
And okay. So doctor, there are multiple doctors involved, the brain doctor, the exercise doctor, the speech doctor. We have been connected with many doctors, but here we don't know anyone. And we
Okay.
want your help that you're gonna connect us to all these specialities.
Yes, yes, we will do that. And also, can I just for information, can I know what are the current medications he's taking?
Doctor, he was taking some medication to relax his muscle. His brain doctor advised him, and he was been on, the exercise doctor has been seeing
Okay.
him, and
Mhm.
he's been involved with a speech doctor, who has been taking care of his speech. And back home, we have been also seeing that bone doctor, the orthopedic doctor.
Okay, okay, perfect. And when were his last tests done? Any scans, any test reports that you would like to share?
Yes, doctor. Unfortunately, doctor, we don't have anything here, but we
Okay,
have arranged, as soon as we arrange to get all those documents from our home city, we'll definitely share
sure,
with you.
sure. Thank you so much. I'll just run quickly through our checklist. Just let me know if it's yes or no. These questions are for me to understand Ashley's current condition better, right? So,
Yeah,
is he
sure.
having any headache at the moment? Headache?
Doctor, he cannot communicate well, so he feels
Oh,
agitated more nowadays.
oh, okay. Any fits that you noticed?
Doctor, he's been on, sorry, I forgot that. He's been on
Mhm,
epileptic medicines, yeah, but his
mhm.
fits are controlled.
Okay.
Yes.
And you were saying he's agitated more compared to before at the moment?
Yes, doctor. I don't know why, because of the more bending of the back or pain in the joint, or I don't know, he's not able to digest. I am unable to sort it out.
We'll try to figure out that, Mrs.
Yes.
Melling. Also, have you noticed his heart racing?
No, doctor, I didn't notice that, but the only thing is that I noticed that he feels agitated from time to time.
Okay. How is his poo and pee?
He's on laxative, doctors, and
Mhm.
for the
Okay.
past 6 months, he's on laxative.
Right. How are his feeds going on?
Doctor, I feed through the tube, the stomach tube that he has been
Right.
put for us, 3 months back in the New Zealand,
Mhm.
and he feeds through that.
Okay. Any cough, cold recently that you've noticed?
No, doctor,
Okay.
no
No
any
breathing
problem.
difficulty. Right. Right.
No,
And
no,
also, have you noticed any rashes?
no, doctor, there's no rashes.
Thank you so much. So I'll be asking a bit of personal questions if you don't mind, but it's part of my interview. I wanted to know how was his birth? I mean, how were you doing when you were pregnant?
Doctor, his birth was, very difficult when he born. So I had a quite prolonged labor. My obstetrician have really difficult. They told me I might, lost my child, but fortunately, with the forceps, and then they suddenly, do the cesarean, and my son has a delayed cry after that, and he has to be in a NICU for
Okay,
many days.
okay, okay. I'm so sorry to know that. Must be a lot for you. Um,
Yes,
okay. And were you taking any? I'm sorry to ask this, but were you taking any drugs or alcohol that time during pregnancy?
no, no, doctor, I never take the drugs.
Okay. And all your scans were okay during that time? Jelly scans?
Yes, doctor, my all scans were normal, but only the thing is that I have some, the diabetic issue, that's, the pregnancy related diabetes, and that was all, the result after my pregnancy.
Okay, I see. And also, are Ashley's jabs all up to date?
Yeah, doctor, I'm very particular about his jabs. And when we are back in New Zealand, he's
Oh,
up to date with the jabs.
oh. And how has his weight
His
been?
9 minutes past, 9 minutes past.
Okay.
Doctor, his weight is always on 9th percentile.
Okay. And have you been seeing a dietitian?
Yes, doctor. I'm
Right.
sorry that I forgot to tell you about that. He's been connected with a nutritionist as well.
Perfect. And he's no allergies, drug allergy, food allergy?
No, not as far as I know, doctor. Never I
Okay.
noticed.
Perfect. And have you been seen by any pediatrician, any developmental pediatrician who's done an assessment for him?
Yes, doctor. He's been seen by the developmental pediatrician initially.
Mhm.
But then again, if they refer to us to the brain doctor, then the brain doctor has been, it's actually a
Yeah.
multiple doctor has been seeing involved, and he's been
Yeah.
managing his progress.
Okay, okay. And I know it must be a lot to take for you as a family. How are you doing? Coming all the way, are you on any support? How are you managing?
Thank you very much, doctor, for asking this. Actually, yes, we need the support, and because we have two more children, and it's very difficult for us to take care of him, to transport him. The hospital is far away. We don't know exactly where to go, and so there are many things, and we actually need some support.
I understand, Mrs. Melling. We'll try to do our best in that area also. And emotionally, how are you doing? How are you and Ashley coping up?
Actually, doctor, sometime I got depressed because of my son condition. Because my other children, I have to take care of my other children, and sometimes I feel that he's neglected because my
Right.
other children also wants time, and
Mm.
it's sometimes feel that I'm not coping up with.
I know it's a lot on your plate. We'll also try to address that, Mrs. Melling. Thank you so much for seeing me. Just the last
Yes, doctor.
question. You told me you have your husband, yourself, and three children, right? In your family?
Yes, that's correct, doctor. My two other children, me and my husband.
Perfect, lovely. And everybody is healthy, apart from Ashley, anybody, all the other kids?
Yes, doctor. All are healthy. My both children are, and me and my husband are,
Yeah.
we are not relative, and we are, yes.
Right. And was he ever admitted in the hospital prior to, after
Yes,
being diagnosed? Yes.
yes, doctor, multiple times. He's been
Right.
admitted for this tube, and he's
Mhm.
been admitted for this, so one time he had this pain in the joint, hip joint. He's been admitted multiple times. It seems like a hospital is my
Right.
second home.
I know you are being very strong, Mrs. Melling, and I really kudos to you. And I'll see how we as a team can help you adjusting in this new city. Thank you so much
Thank
for
you.
talking to me, Mr. and Mrs. Melling, and lots of regards to Ashley as well. I will discuss your case
Thank
with
you.
my consultant, and I'll get back to you on this. How does that sound?
Thank you very much, doctor. I'm looking forward to that.
Thank you.
Okay.
Ma'am,
Okay.
considering
Yeah.
there were breaks, I'm so sorry. There were breaks. So how
Mhm.
long has it been?
It's time's up now. You have to summarize your friend.
Okay,
Time's
so
up.
I will start, ma'am. So today I had the opportunity to interview Mr. and Mrs. Melling, 9-year-old Ashley's parents, who is a known quadriplegic with cerebral palsy, and he's shifted recently to the city from New Zealand and was managed by a multidisciplinary team. But now they're trying to adjust. He's noted to have a new onset, which looks like scoliosis is increased, and also symptoms of GERD, and he's having this hip pain that needs to be investigated. Other than that, he's on a couple of medications that he's following, and the team, including physiotherapist and all the other discipline team, are involved. We need to just his past birth history and family history is appropriate, and what we know is the parents are having difficult time to adjust. So is Ashley. So we need to help in that area financially and emotionally. Yes, he's
So
also a
doctor,
known
tell
case of
me the unknown case of what?
epilepsy, which is being controlled well.
Yes. Okay. So doctor, tell me, you have taken the history. Now tell me, what do you think? What is the biggest issue that Ashley is facing at the moment? Mother told you multiple things. But
Right.
what do you think? What is the biggest concern? Why the parents are here?
Right. Their concern is that they are new to this place and they want their support system to be included in this city as well. So, if we have a multidisciplinary team which is now taking care of Ashley's problem, the current and the previous, everything is going to be streamlined. So, they want to be adjusted well to this place and they want help in that.
Okay, so that's for the parents. But what exactly the child is suffering from? Then
Yeah, I think
parents are
he's
not.
possibly having contractures, his scoliosis
Mhm.
increased, and there's GERD. So these three are the main
Okay.
issues that needs to be seen by the respective teams.
Okay. So tell me, doctor, what are the different way in which you can help the Ashley's parents to settle in the new countries? What are your
Uh,
plans?
yeah, my first plan is to send them across to various doctors, that is having a board a pediatrician, I myself, the neurologist, then this gastro, the speech language therapist, the physiotherapist, the bone doctor again, and also a psychologist for the team, for the parents as well, a counseling session. All these multidisciplinary team needs to be get back, and his previous data they're going to get from their country needs to be understood by everybody, and now the system has to carry on forward.
Okay. So keeping the history in the mind, what is your priority team that you will likely to involve in this child?
At the moment, I'll first refer him to an orthopedician, and I'll take care of the other areas, but the orthopedician to see his scoliosis and his possible contractures and take care of that. And also for GERD, we need to help him with that. So we'll try to see those areas as well.
So doctor, what are the different ways to control the scoliosis or the contractures?
A physiotherapist is very important. Then I think I will have to involve the orthopedician and then take his opinion on this. And
Okay. Any medicines are given? Do you control the contractures, doctor?
I need to read on that. At the moment, I'm not able to remember, but I'll read on that and get back to you.
Okay. Yeah. So do you find any medicine tablets or any injection or any surgery
Oh
or
yeah, that
thereabout to prevent that?
contracture release surgeries, I know, I'm aware of that, and I think he's been given a muscle relaxant, possibly baclofen that he's been given.
Yeah.
So yeah,
Okay.
I'll look into that.
So, so doctor, what are the more, anything else, how you, financially, how you will support them?
Yeah, I'll
How,
have
which support group you want to involve? How
that.
you will help them in financial support?
As per my knowledge, I think they have to apply for disability living allowance. So we take them across through a social service worker, and then they'll take
Okay.
care of all these things.
Okay, so doctor, what are the actually have a feeding problem as well. So
Mhm.
what are the causes of feeding problem and the drooling in the children who have cerebral palsy? Find anything that why these
Uh,
children have a
can you repeat your question, doctor? I was not able to understand it well.
so what are the problem the Ashley's facing the severe feeding problem and the drooling and difficulty in swallowing. So what are the
Mhm.
commonest cause in the cerebral palsy which leads toward these complications?
I think it's a pseudo bulbar palsy, which is, that area when it's affected, then the child can have symptoms of
Okay,
drool. And also he's on gastrostomy. So even despite that, because of the palsy in that area, you will have these
okay,
symptoms.
okay. So doctor, tell me how you will diagnose the cerebral palsy. What are the causes? Sorry, not diagnose. What are the causes of cerebral palsy? Can you please tell me?
I'll broadly classify it into
Yes.
prenatal, natal, and postnatal insults. And then there is a big list for that, especially if the child had
Okay. Can you
um,
please
well
tell
as
few things?
yeah,
Prenatal.
prenatal if there were infections, if there was a trauma, then natally if the child had hypoxia, hypoxic ischemic encephalopathy, sometimes in sepsis or in intraventricular hemorrhage, you can have that. Yes.
That's a natal, perinatal, right? Hypoxic ischemic
Yes.
encephalopathy. Infection, what kind of infection consider in the prenatal cause? What are the commonest infection leads towards the cerebral
Uh,
palsy?
um, at the moment, I'm not able to recall. Sorry
Okay,
for that.
Okay. If I tell you that, doctor, you need to investigate the cerebral palsy, do you have any broader classification for that?
We divide into 4 classifications. One is, I think it was ataxic, spastic, but I think again I have to read on it. I'm sorry. Can we move on to the next question,
Okay,
please?
that's your time's up, doctor. Yeah,
Thank you.
thank you very much. Thank you very much. Yes, so Dr. Shruti.
I need to read CP. Oh my God.
Yeah, cerebral palsy, that's no issue, but your flow was good, but the only thing is that this is a chronic history. This is
Right.
not the history to diagnose the case, right?
Okay.
Whenever there's a chronic history, your question should be, you should tailor your history according to the diagnosis. Once you know there's a cerebral palsy, you should start with Mrs. Track, welcome. And this is an OPD setting. You just see this is the outpatient department. You just welcome. And you don't need to ask them, would you like anyone else to be a part of, because they came to the OPD, right? You are not,
Yes.
coming to, this is not a communication center. They are sitting in the OPD. They both came with the appointment. Definitely they have taken the appointment. So once you've taken
Yes,
the
ma'am.
chronic history, so the question should be, Mrs. Malik, can you please state how your child get diagnosed? So this is your question.
Mhm.
You need to know how the child get diagnosed and by whom. Can you please tell me how many teams
Okay.
of doctors has been following him? Can you please tell me what is the major concern that brought you here today? You have to ask that. He's been already been diagnosed, right? You know that he is a cerebral palsy.
Right, ma'am.
What is the major concern that
Yeah.
they brought? Is they here to settle in the city? This is the question I was asking you in the Viva. But you have to ask the parents, what leads to here you today? Why you are here today? Is you are already been diagnosed. I know that you are new in the city, but
Mhm.
what is more disturbing to you? What do you think it's more concerning towards to you? Why you are here today? So they will tell you, Mrs.
Okay.
We are here because of the pain in the leg or what. And then you tailor your question that how many times he get hospitalized. Is he taking any drugs? Is he having any list of complication? You ask that. But if you start with a history of presenting complaint, how he has been diagnosed, what team of doctors, tell me, is he on any list of medication? And then you just proceed with that because he's already been diagnosed. You need to, focus on the underlying issue that why he is here today, right? And then you have, your history was not bad. You covered all points, but the only thing is you need to be more confident when examiner asking you. This is not a communication that you will see, I'll go back and study, right? He wants to
Yes.
listen that. Right? He wants
Yes,
to
ma'am.
listen that this you can handle in communication, that I'll go back and update and get. The examiner wants to know about your knowledge, that how much knowledge you have regarding this financial. And in this
Yes.
case, you can always, the mother said, I am very much disturbed. You can, involve the respite care, you can financial support, disability allowances. You can give the contact support group, to the family. You have
Yeah.
arranged with the epileptic neurologist, multiple team. And this is the history of, from the Mrcpch. Yes, Dr. Shruti, tomorrow is your
Yes,
exam.
ma'am.
Just
Yes, this is the first
scan.
CP
Yes,
comes in history. Yeah.
yes. So, no,
I
your
remember.
knowledge is good. So, inshallah,
Could
the
you?
good thing is that you handle it well. Your flow was very good. And the only thing that you need to tailor your question accordingly to the chronic history, acute on chronic, and in acute on chronic, you start with the symptoms, what symptoms, and in chronic history, you have to ask it how your condition has been diagnosed, what the team of doctor
Okay.
in what medication you are on, so how many visits you have, are you taking any, what are the biggest problem that you are, what is your biggest concern that you are here today? Obviously he's a cerebral palsy, but you need to have words with the parents that what are the disturbing, then why they want to settle in, and any other major problem that they are suffering from. So this is how we can
Mm.
but definitely
Ma'am,
all the
yes,
best,
sorry,
Dr. Shishti.
one last thing.
Mhm.
Thank you, ma'am. Just the question you asked me about classifying, is it that Could you tell me about that? Just 2 minutes,
No,
if you can
yeah,
tell me what did you mean?
yes, I told you that. Can you please tell me what are the causes of cerebral palsy? So they are very broadly,
Yeah.
just tell them yes. I don't ask you about the types of cerebral palsy. Cerebral palsy has a 4 types, spastic,
Yes.
dystonic ethetoid, ataxic, mix, right? These are the 4 classification types of cerebral palsy. We call it classification. What are the causes of cerebral palsy? Here, how you can say the causes of cerebral palsy is a prenatal, perinatal, and the postnatal. In the prenatal, I asked you what are the commonest infections. What are the commonest? Obviously, torts are the commonest infection that leads toward
I
the
thought of telling that. True, ma'am.
yes,
True.
torts are the
Okay.
so torch are the commonest infection. This leads toward these kinds of cerebral palsy. There are other infections as well. The HIV also one of them. But to keep you always highlight the main thing. Just remember the torch, the multiple infections covered in the torch. So tell them torch is the there's a genetic causes which involved in the perinatal, right? And they are in the this is a prenatal. In the perinatal, you have trauma, hypoxic ischemic encephalopathy, right? Neonatal and the ventricular hemorrhages, episodes of hypoglycemia during the delivery. The all cause these towards the
बाबू मैं काम कर
these
रही हूँ आप वो देख रहे हो ना मैं क्लास सुन रही हूँ अपनी
and then the postnatal. When the postnatal is the major, the commonest cause is meningitis. That's why we ask in the cerebral palsy, tell me how your child has been diagnosed. Your starting question when you are, looking a chronic child, any child with a cystic fibrosis, you will ask that, Mrs. Can you please tell me your child diagnosed at the birth, or is being diagnosed, following after because of the certain symptoms, or how? This is how you should start the, question regarding the chronic history. And then the postnatal causes are the head injuries, strokes, meningitis, encephalitis. These are all causes leads toward the cerebral palsy. So if the examiner asks you what are the causes, you can tell them the prenatal, perinatal, postnatal. If asks you, can you please classify the cerebral palsy? Then you lead toward the yes, that there are 4 types of cerebral palsy. The spastic again divided into the quadriplegic,
Yes.
the diplegic, the monoplegic, the hemiplegic. Then what are the texts? Then ethetoid. Ethetoid CP, dystonic CP comes in the Wilson disease. Have you think about Wilson disease? And then there's a
Yes, ma'am.
dystonia.
Yes, yes.
When if there's a high bilirubin at the time of birth, because they involve the basal ganglia, they cause this dystonic CP. Then what ataxic CP? Ataxic CP involve the cerebellum. We usually see after ataxia usually in the older children when there's a cerebellum involved. When there's after acute, just all memorize all causes of ataxia that can lead toward this
That, ma'am.
cerebral palsy. And then there's a mix
Yes.
in which we can have a spastic as well, dystonia as well. So this is how you can remember the cerebral palsy. Okay,
Thank you so
so
much,
I
ma'am.
think
It's really
you're welcome. And I wish you all the very best of luck, Dr. Shruti. You work very hard, and we pray for you that, all the hard work will pay off tomorrow, and definitely will
thank,
get the highest score in each and every station, inshallah.
thank,
Any other
thank you so
questions
much.
from any candidates? You're welcome. So I think now we should sign off and wish you all the best of luck, Dr. Shruti. Take care. And
Thank you, ma'am.
if-
Yes,
you're
ma'am.
welcome. And if no one have any question, then you can sign off. Okay, take care. Allah Hafiz. Thank you everyone for joining.